topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Tennessee. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. We get so many emails from you, and I got to tell you, we read them all. And about 3 or 4 months ago, we start getting emails asking us to do a show on Lasik, on cataracts, on different types of eye surgery. And we didn't have an opening. And recently we got an opening, and I can't believe we were so blessed to find the top ophthalmologist in Tennessee, Wang Vision Institute. And this is going to be our third show, but this is going to be our second show for Dr. Jones. Good afternoon, Dr. Jones.
Steve.
Dr. Jones?
Can you hear me?
Yeah, we can hear you now.
Perfect.
Okay. So listen, I was just giving you the big head. I was giving you kudos. We are so blessed to have you as part of our show. And you're going to be talking about cataracts today.
Yes, that's correct.
Well, I'm going to tell you something. I actually found out that I need cataract surgery. And it's not like, it's not just, okay, I'm going to go get cataract surgery. There's different kinds, which we'll discuss today. And there's different options of cataract surgery. Like Dr. Jones, when you're driving and you see things get not a lot, but get a little blurry.
Right.
Oh my God, that's when it's time, isn't it?
Basically, that's correct. So cataract is just a natural aging process of the lens of the eye, which sits right behind your pupil, that black spot right in the center of your eye. And as you get older, it just becomes yellow and cloudy, hardens, and just ages and blurs the vision. The earliest symptoms are generally, for most people, night vision problems. So trouble seeing at night to drive, glare and halos, starbursts around lights at night make it very difficult to drive.
Yes.
Those are some of the earliest symptoms, and they can be very disabling. And so cataract surgery is definitely indicated if that's affecting your ability to drive. Cataract surgery can help for sure.
Well, first of all, tell us about Wang Institute. What you have built up. I think I was telling you that we had 2 ophthalmologists contact us who heard your show, were so impressed. And usually, Dr. Jones will usually say, oh, he made a mistake doing this, and we're better. And no, we got kudos from both of them, 2 different practices one was in Nashville and one was in Memphis.
Oh, great. Yeah, that's wonderful. Glad to hear that. Yeah, Wang Vision Institute, we do a variety of different things, but our main focus is on vision correction surgery. So that includes, as I talked about on our last show, LASIK, small incision LASIK, also known as SMILE. It includes implantable contact lens surgery for people who aren't a LASIK candidate. And it includes lens replacement surgery. So that's refractive lens exchange. And then, of course, laser cataract surgery for older patients who have developed cataract. Those are our main areas of expertise.
And we had someone who texted us before the show wanting to know if you do optometry also.
We do. We have 2 optometrists in our practice, and we do general eye exams, and we prescribe glasses. The only thing we don't do is we don't prescribe contact lenses. That's the main difference there. But we do have optometrists, yes.
Do you ever? We had people who wrote us because we have a lot of families that watch or listen to the show. They wanted to know what is the best age to bring your child in to have their eyes checked.
Yeah, that's a great question. In general, within the first few years of life, it's good to bring your kids to a pediatric specialist ophthalmologist to have
Oh,
an
there's
eye
a
exam.
pediatric.
Yeah, we do not specialize in pediatric ophthalmology, but there are specialists within ophthalmology called pediatric ophthalmologists who do eye exams specifically for young kids. And they specialize in prescribing glasses for very young kids and strabismus surgery, eye muscle surgery. That's one category. But in terms of being a good candidate for laser vision correction, it usually starts at the age of 18 and beyond in terms of actual vision correction surgery, because that's when usually the glasses prescriptions will start to stabilize for most people. And some patients not. Some people need a few more years beyond that. But yeah, there are specialists in pediatric ophthalmology that do eye exams for kids.
So, what is laser cataract surgery? How does that differ from, say, regular cataract surgery?
Sure. Well, cataract surgery in general is just removing the cataract from the eye and in its place placing a lens implant to correct the vision. Now, traditional cataract surgery, many years ago, decades ago, involved large incisions and involved removing the cataract from the eye using metallic instruments and metal blade and scalpel-like instruments. And it's progressed. Over the years into small incision cataract surgery, which involves much smaller incisions, usually less than 2 millimeters. But still, for most cataract surgeries, it's being done with blade and metallic instruments. However, at Wing Vision, we do nearly 100% of our cataract surgeries with laser. And what does the laser do? The laser increases the safety and precision of the surgery. So it actually automates some of the surgery.
He bounced right out of there. I think he pressed the wrong button. he, he might have been a little
Hey, you know
fidgety.
what? We're doing a live show, so things like this happen, and I'm sure he'll be right back. We're talking with Dr. Jones of Wang Vision Institute. Rebel, does he know he's not on the air anymore? We didn't lose you too, Rebel, did we?
No, I'm here. While
Okay.
I was going to give him a call. While I give him a call, why don't you tell our listeners about how to become an expert on the show?
Oh, that's wonderful. Yeah, listen, we have such a large audience. We are on some of the most amazing platforms. We're on iHeart, we're on YouTube, we're on Spotify, we're on Pandora. I didn't even know we were on Pandora. I just found out recently we're on Pandora, but we're on 90 different platforms. So we've got this huge audience, and we actually break our shows up by state and city. Today we're doing Tennessee today, and it's a show that we work with in the areas of legal, health, financial, and home improvement. And what's so amazing is that our interviews do so well that the companies end up staying with us forever. We have some companies that have been with us as long as 11, 12, and 13 years. They've been with us that long. It's just such a great way to promote your company, position yourself as on our show as an expert. And it is, we used to do this show strictly on terrestrial radio, and friends of mine kept saying, "You gotta go to podcasts." And I'm going, "Who listens to podcasts?" And I actually, what
Hello, can I
happened,
help you?
what's that? Still no Dr. Jones? Where this is, see, folks, this is a live show. And when you do a live show, sometimes you get freezing. Sometimes, oh, I see him coming back.
Hi there. Can you hear me?
Yeah, we can hear you fine.
Perfect. Yeah, I don't
Did
know
you
what happened
push the
there.
wrong button?
No, I didn't click any button. It's weird. The browser just froze and cut off.
Wow.
Yeah, I
Well,
don't know what happened there. I didn't lose
we
my connection at all or anything. Yeah, I don't know what that was about.
I'm glad you're back with us. Let's look at the chat line. Francis wants to know, is there a lifetime fix or does this have to be repeated?
Cataract surgery.
Yes.
Um, so cataract surgery, the implant that's placed at the time of surgery lasts the rest of your life. So it's made out of
Oh,
a biocompatible material, and that correction that provides for your vision will last the rest of your life. Cataract doesn't come back per se. However, a certain percent of patients will develop some cloudiness of the capsule that's right behind the lens implant, and they may need to have what's called a YAG laser, which is a quick laser procedure that we do in clinic to remove that to help improve the vision. um, Sometimes glasses prescriptions may change as one gets older after cataract surgery, and sometimes glasses may be required. And if you don't want to wear glasses, additional LASIK or laser vision correction can be done.
hey, Dr. Jones, we just got 4 texts in from 4 different people, all having the same question. People wanting to know, can they go back to work the next day?
So it kind of depends on what one does for work. Normally, I tell patients day of surgery, go home and take it easy. The eyes will be a little, they'll feel a little dry and gritty. The vision will be blurry. The next day, the vision will be better, but it won't be up to 100%. For most patients, it'll take maybe up to a week for the vision to get up to 100% of what you can expect. But the day after surgery, you can resume basically most normal activities. So that would include working on the computer if you feel like you're able to, that's fine. You can be on your phone, on your cell phone if you need to be on that. You can resume basically most activities the following day. People who work in really dusty or environments where there's a lot of dirt and things like that in the air, I typically would recommend giving it about 2 weeks to let all the incisions heal because that's an infection risk. But if you feel able to work the next day after cataract surgery, that's great, and you're able to do so for vast majority of people with most occupations.
Okay, what about sissies like me, Dr. Jones? How bad is the pain?
Yeah, the procedure is really not painful at all. So, like I said, at Wang Vision, we do almost 100% of our cases are laser cataract surgery. There's very mild pressure on the eye during the laser portion. And then for the surgery portion, where we remove the cataract and place the lens implant, you really may feel only occasional slight pressure and almost like a water sensation over the eye. But pain is not present at all. Numbing drops are placed and you're slightly sedated for the surgery. You're awake because we need you to fixate on a light during the surgery. But there is an anesthesiologist that's present to give you anesthesia to keep you nice and relaxed for the procedure. But there is no pain.
And you do the procedure right in your office, right?
We don't do cataract surgery in our office. We do it at our surgery center that we own right down the
Oh,
street near Centennial Park. Yeah, so we have a surgery center that does nothing but these cataract surgeries.
is that where you do LASIK also?
We do LASIK in our office. LASIK and
Okay.
SMILE we do in our office. Implantable contact lens, refractive lens exchange or laser lens replacement, and laser cataract surgery we do at our surgery center.
So I know there's people thinking right now, like, who is a good candidate for laser cataract surgery? I mean,
Yeah.
how does someone know?
Yeah, no, it's a great question. And patients ask us that all the time. Really, what I tell most patients is it's based on your symptoms. And there are patients that I see in clinic who have what appear to me to be quite significant cataracts, but they aren't bothered by their vision. They are not struggling with driving. They're not struggling with reading. They maybe don't see a lot of glare and halos, or if they do, it's not super bothersome. They can hold off on cataract surgery. However, if a patient starts to develop symptoms, they start to become bothered by night driving, trouble seeing at night, glare and halos, starbursts while driving at night, making it difficult from the headlights from the cars, then typically at that point, I tell patients it's worth considering cataract surgery. It's not really based on the stage of the cataract or what it looks like to me as the doctor. It's more based on your symptoms.
Beverly in Nashville wants to know, is this covered by insurance?
So cataract surgery, we do bill your insurance because it's cataract surgery is a medically necessary procedure. However, two portions of the surgery may not be covered, or usually are not covered by insurance. And one that's the laser portion of the cataract surgery, as I mentioned previously, that increases the safety and precision of the surgery. And then if you elect to get a certain type of premium lens, such as an astigmatism correcting lens or a lens implant that gives distance and near vision without needing glasses, there will be extra out-of-pocket charge for you.
I don't understand that, Dr. Jones. How could insurance not cover that? Something as important as your eyesight.
Yeah, well, like I said, insurance, they'll pay for all blade surgery and just a regular lens implant to give you the bare minimum vision that
Right.
you can. The insurance companies don't really, necessarily care if you have to wear glasses for everything after cataract surgery.
Yeah.
They don't care if it's the most precise, say, even safest surgery at all. They're, insurance companies are a financial company, so they have financial concerns and all of this. But in terms of outcomes, as someone who's done a lot of cataract surgery, I can tell you the outcomes in my hands are certainly better with laser cataract surgery and patients who elect to get premium lenses to correct their astigmatism. And if they don't want to wear reading glasses, there's lens implant options available for those patients as well.
Is there a big difference in price when you move up into laser?
There's definitely a difference in price. I would say on average, it kind of depends on the different packages. In our office, we have different packages that include certain things. So there's certain packages that will include the laser in the package, and maybe the patient will still wear reading glasses afterwards. If they want to have lens implants that, like I said, will give distance and up close vision, that'll be a little bit more. And then there's another package that is, we kind of call it like an all-inclusive package that will include laser, a premium lens option, and any potential enhancements or adjustments that we may need to do to the surgery afterwards will be all included. So there's kind of a few different price points. But yeah, in terms of insurance, yeah, for most patients with Medicare, for example, that usually will cover the entire surgery with just blade cataract surgery and a standard lens implant where you wear glasses full time afterwards. What we're talking about is an upgraded type of surgery with a better quality of life afterwards.
Ooh, we just got a text from Chattanooga. This is from Gloria in Chattanooga. I am loving this show. It's about time someone did a show on eye surgery like this. I hope this is not a stupid question. Do you do both eyes at the same time, or do you do one eye at a time?
Typically for cataract surgery, we will do one eye at a time. So we'll do one eye on one day, and then just on a separate day, do the other eye. And there's a few different reasons behind that, but basically the vision can be a little bit blurry, especially the first day after cataract surgery. So it's a little bit easier in terms of vision functionality to just do one eye on one day and do the other eye on a different day.
Oh, that makes sense. What about, are there any side effects or risk?
Yeah, I mean, there's risk with any eye surgery. This is an intraocular surgery, so there is a very, very small risk of infection. It's between 1 in 1,000 and 1 in 2,000. There's risk of retinal tears or retinal detachment, some swelling. All these things are generally very small. The cataract surgery in general is about 99% successful in terms of improving vision. There's that rare 1% a case where maybe afterwards the vision may not be as good as it possibly it possibly could, but complications are very rare. Very successful surgery overall. Side effects are pretty uncommon as well. If you get a certain type of premium lens that gives near vision without needing reading glasses, those lenses can cause a little bit of glare and halos around lights at night, and a lot of patients will notice that. So that's a big side effect of that lens. Some patients with non-premium lenses may notice that a little bit as well, but it's more common with what's called a multifocal lens.
Dr. Jones, this next text, I know this is a relative of yours writing this in. This is from Mark in Nashville. You did my mother's cataracts, and you guys did such a great job. I just wanted to write you and let you know. I know that's a relative of yours, Dr. Jones.
Well, that's great. I appreciate that.
We'll send them a check, won't we?
Right, exactly.
So now, how long is the surgery actually?
The surgery is pretty quick overall. Usually you're at our surgery center for the total time of just maybe a couple hours. The laser portion of the surgery takes just a couple minutes, and then the removal of the cataract and placement of the lens implant is usually another 10 minutes at most. It's very quick. The longest part of the whole process is just getting your eye dilated, getting you ready for the surgery, and then sending you home. You go home right after surgery.
What about recovery? Are you in recovery for a long time?
No, you're not really in recovery a long time at all. Basically, really all we do is place over the eye with tape a clear plastic shield, just so you don't rub the eye or rub it accidentally while you're sleeping the first few nights. And you just wear that while you're sleeping. When you get home, you can take it off if you want, as long as you don't rub your eye. The recovery is pretty straightforward and pretty simple with cataract surgery. There's really minimal pain. Just like I said, a little bit of a foreign body sensation day of surgery. That's usually gone the next day. And then like I said, the vision can be just blurry the day of surgery, but it's usually much better the next day. And a lot of people just kind of resume most normal activities the next day, except the caveats would be staying out of water, like pools, hot tub saunas, staying out of dusty environments, and trying to limit exercise as much as you can. No bending over, heavy lifting, nothing too aggressive where you're going to get sweat in the eyes for 2 weeks.
Are there any common misconceptions about laser cataract surgery?
Yeah, there are a few misconceptions. One I kind of already alluded to, where there's a misconception that maybe a cataract has to be kind of fully developed or fully ripe, as some might say, before it fully mature, before someone is a good candidate or can have cataract surgery. And that's simply not the case. At Weighing Vision, we do cataracts all the way from, kind of what appear to be the earliest stages, but maybe the patient's quite symptomatic, all the way to very dense, mature cataracts. I do the full gamut of those. And it doesn't have anything to do with the stage of the cataract. It has to do with the patient's vision and the symptoms they're having. If they're bothered by their vision, cataract surgery is a very safe surgery. Like I said, 99% success rate in terms of improving the vision. And it's worth doing if you're bothered by your vision. Okay. Other misconceptions would be kind of what I already mentioned, that the surgery is painful. They're worried about being awake for the surgery. They're worried about pain during the surgery. That is really not an issue. There's no pain, and you are awake, but you're sedated, so you're nice and comfortable and relaxed for the surgery. The surgery, some patients may have a misconception that the surgery is kind of very invasive. The surgery is very minimally invasive. Actually, it's all done through a small 2 millimeter incision. We don't remove the eye or make large incisions that require stitches. 99.9% of the time, incisions do not require stitches at all with cataract surgery. They seal on their own. So the surgery is minimally invasive. Other misconceptions would have to do with glasses, like, oh, well, I still need to wear glasses afterwards. Some patients will, especially reading glasses, but there are options available, like the trifocal lens. And we were the first in the state of Tennessee at Weighing Vision to place trifocal lenses, and we do them every single week at our surgery center. So we're very experienced with that technology and helping patients who have cataracts, who maybe don't want to wear glasses after surgery, want to minimize their dependence on glasses. We have options for those patients. Other misconceptions would have to do with, can the cataracts come back? It's a one-time surgery. Like I mentioned, cataracts don't grow back with time. The lens implant lasts the rest of your life. And then just overall the general risk of surgery. It's not a risky surgery at all. There's risk, of course, with any eye surgery, but this is a very safe surgery. And in fact, it's done in this country alone probably about 3 million times a year. So this is our most
Wow.
common surgery we do. It's the second most common surgery that's done worldwide, just behind C-section for pregnancy.
Wow.
So it's a very common surgery, and 28 million cataract surgeries done around the world each year. So it's a very, very common surgery.
How do people reach out to Wang Institute?
Yeah, we have a website, www.wangvisioninstitute.com, that has all of our contact information on it, has our phone number, has an email address that you can email with any particular questions regarding surgery. We have a phone number as well that's on that website. You can call to set up an appointment. You can ask questions. You can email. And there will be someone available to answer any questions you might have and set up an appointment.
Let me give everybody who's listening on radio right now or iHeart or Spotify, the phone number is 615-321-8881. It is Wang Vision Institute. And listen, I'm going to tell you something. Not only are they the best, there's people from all over Tennessee who come in and have them perform the surgery. Dr. Jones, I know you're going to be back again with us. And, wow, we got a lot of texts come in. Thank you so much, and we're going to see you soon.
Thank you. Thank you for having me.
Thanks, Dr. Jones. That's Dr. Kyle Jones, Wang Vision Institute. Hey, that's it for us today. I want to say hello to my new friend in New York, my jewelry new friend in New York. That's it for us today. Thank you so much, Rebel. You'll have to explain to me what happened after the show. See you all next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.